Robotic surgery is a newer advance that is applicable to a lot of fields, but has some really exciting applications for reproductive medicine and infertility. Traditionally, surgery has been done either through a large open incision or through a minimally invasive procedure called laparoscopy. Laparoscopy has had advantages because it uses smaller incisions. It's much less invasive surgery. It has a much shorter recovery time and is more cosmetic. But traditional laparoscopy has some limitations because the instrumentation that we use does not give us as much facility to use our hands and do complicated procedures. So there's traditionally been a trade-off between minimally invasive surgery and open surgery. What's been really exciting now is with the advent of robotic surgery, we can accomplish essentially everything we can do with open surgery, but through these minimally invasive incisions. And this has two really exciting applications for reproductive medicine in the field of infertility, which is in terms of removing fibroids for the uterus. That's a procedure called myomectomy. And for very delicate microsurgical procedures like putting back together tubes that have been cut or ligated from a tubal ligation sterilization procedure. Robotic surgery basically combines the best of an advanced laparoscopic surgeon's own surgical techniques along with a robotic surgical assistant. Essentially, the way robotic surgery works is that the surgeon will be at a console in the room with the patient, doing all of the same movements and techniques with their hands that would be done on the patient directly. The robotic instrument has its own arms, for lack of a better word, which are attached to the instruments inside the patient. And the robot is designed to very precisely mimic the movements of the surgeon connected to the robotic instruments that are being utilized within the patient. It takes this technology even one step further because any imperfections or anything else that may occur in the surgeon's hands can be essentially smoothed out by the robot. In addition, the robot can make even more precise movements because large movements by the surgeon can be translated into very small movements with the robotic instrument, which makes our control even finer than would be allowed otherwise.